Because in this mouth of ours, there are more than 10,000 bacteria in it. And that place is their normal habitat. Because it is their normal habitat, you can't push them out. They are hungry just like human beings. Whatever you bring into the mouth, they will start working on it. And by the time they start working on it, if you don't rinse, if you don't brush, if you don't floss, your teeth will start decaying unknowingly to you. That is why it's very important we are conscious of whatever we do, especially when it has to do with our mouth, our oral cavity. Let me also show you some things here. I want to break down to you the calorie value of each food or each constituent of food that we take in. Every food that we take in has calorific value. Some have more than others, but I was able to pick few that I want to show this evening. So, if you look at there, if you see tomato paste, you can see the calorific value there, 19. You can see food standard amount, all are stated here. Yogurt, prune juice, carrot juice, 71 calorie, Hollywood cooked, 119 calorie, soya beans, green cooked, half cup, 127 calorie value. You see, the food is planned according to the calorific value. If you don't plan your food well and you just eat like that, before you know it, obesity comes. And I was reading yesterday, I found out something. I didn't even know that cancer has something to do with oral diseases. I didn't even know before. I was surprised when I saw it, that cancer has a little bit relationship with oral infection, oral diseases, and so forth and so on. Diabetes, and 3 different diseases that are killer diseases as I see them. I didn't even know that they have anything to do with oral hygiene. But I was shocked when I saw it as I was reading it yesterday. So I began to wonder. I said, oh, so even cancer that is deadly has something to do with the mouth. Which means it's a bonus for dental hygienists, it's a bonus for dentists. So we need to know that the most important thing we need to do is to get our diet planned. And as we plan our own diet, we propagate it. We let everybody around us know that it's good to eat healthy. If you don't eat healthy, it will not help you. Now, let me relate it to some of the systemic diseases I talked about. Like somebody have mentioned before here, talked about gingivitis, talked about periodontitis, glossitis, and so many others, like I've mentioned. We all know that diabetes comes as a result of sugar. Everybody knows that. We also know that too much of fat causes also heart diseases. I saw in the newspaper also yesterday, it said 70% of Americans are suffering from heart disease, cardiovascular disease. What is the cause? Poor diet. Food has a very important role to play in our life and in our health. If you do not plan your diet well, you will not live well. Okay, the question now is, how do we as dental hygienists counsel our patients to eat the right food? Do you know that as a dental hygienist in 1979, it was made mandatory that before you qualify as a hygienist, you must be able to counsel your patient on nutrition. So which means if you don't have nutrition knowledge, you cannot be able to counsel your patient. So which means you won't have a license. Let me put it that way, because that's what I read in the article. So if you have not been studying towards knowing, getting more knowledge on nutrition, I advise you to start doing it now. Can somebody tell me what role nutrition has to play for our patients? Somebody, just go ahead.
Our nutrition, everything that we eat affects our, we need something that would be beneficial to our teeth, the surrounding bones, tissues. Like, you have to eat enough vitamin C not to have scabies. Yeah. So everything that you eat affects nutrition. Right?
If you are to counsel a patient now on diet, what exactly are you going to ask the patient to observe, the precaution about this, the precaution about that, and or to make sure so and so thing is in his or her diet plan? What are you going to recommend to your patient?
Instead of eating cookies, eat carrots, or apples, or it cleanses your mouth.
Okay. Apple cleanses the mouth, and there's something else it does as well. It gives exercises to the jaw. This jaw that you have here, the mandibular joint, is the only single bone in the body, the mandible. You see, it must have exercise for it to be stable. If you don't give the jaw correct exercise, the jaw, that's why I see some people, they're walking, they're looking like this. Some people walk like that. You may not know. It's not that they intentionally want to walk like that. No. They have failed to give exercises to the jaw.